Hey everyone, thanks for joining us. My name is Kerry Brees, CEO and co-founder of NowRx. We are a tech-powered digital pharmacy. We're going to talk about competition today. We've got some new slides that we created just for today's discussion. We want to do a real deep dive on the competition, and I'm just going to wait here another 30 seconds to see if we can make sure everyone has time to log in. There will be a question and answer session at the end. I'm going to try to limit my presentation to about a half hour, and then we'll do a half hour of questions. We'll see how well I can stick to that. Sometimes I get a bit wordy, but we'll see how that goes. If we don't get to any questions, if we don't get to all the questions, we will certainly post them on the Seed Invest forum and get those questions answered. So I know competitive landscape in pharmacy is always a exciting topic for people. We have a lot to talk about today, so I'm excited. Thanks for joining us on this holiday Friday. All right, I'm going to get going. I'm hoping that everyone has logged in, that's going to log in. If you're just joining us now, my name is Kerry Brees, CEO, co-founder of NowRx, and we are going to focus on competition today. Before I get into the competitive landscape, in case there are some folks on today that are maybe just learning about NowRx, I want to get a little bit into the Nowrx story, just as a kind of lay the groundwork for what we're going to talk about in the competitive landscape discussion. We are in the middle of a crowdfunding offering on seedinvest.com. And we are regulated by SEC rule regulation A, which is an exemption, and you can read about all of that there. So look, NowRx Pharmacy, we're known for same-day delivery of pharmacy, but we are much more than just the delivery component. We created a completely new model for pharmacy that is a full replacement for a CVS or a Walgreens. You never have to go to the pharmacy again with the NowRx solution. We are not just a delivery service, though. We actually built and maintain our own pharmacy capabilities. All the same services you can get at a CVS or Walgreens, you can get through NowRx. You can talk to a pharmacist. You can, learn about your medication. We carry our own inventory. We do our own delivery, our own logistics. It's our employees that are doing the deliveries. It's our vehicles. They're wrapped with NowRx marketing. You can think about it like if you walked into a CVS or a Walgreens. If you go into those stores, it's really in the back of the store where the pharmacy proper is. It's that part behind the counter where there's 2 or 3 employees, and they're behind that counter. There's some shelving, medications are on some shelves. No one else gets back in there. It's only these 2 or 3 people. The rest of the store, is other stuff, right? They're selling vitamins and beauty products and back to school supplies. So we, as a concept, we took that pharmacy proper, that part behind the counter, took it out of the retail location and setting, put it into a commercial warehouse, about 5,000 square feet. We called a micro fulfillment center. We're going to talk a lot about micro fulfillment today because it's important to understand how we're competing in the industry with this kind of business model innovation as well. And inside these micro fulfillment locations, again, we have all the same capabilities of a pharmacy. So we house those commercial locations with pharmacists that work inside that fulfillment center and technicians and our own inventory. We communicate with your doctor. We coordinate with insurance companies. We do all of those things, as well as have delivery capabilities from every micro fulfillment location. All right, so that's what NowRx is. We're a tech-powered pharmacy using a lot of modern technology and a micro-fulfillment logistics strategy. How can we compete in this massive industry? That's why we're here today to talk about it, right? One of the things we noticed when we looked into pharmacy, and we launched the company in 2016, and most of 2015 was spent learning about pharmacy, and even throughout 2016 and the early years. And what we found was there's a lot of things wrong with pharmacy. And it's a lot more involved than just adding delivery to a CVS or Walgreens. There are problems inside the pharmacy. When you go into a pharmacy, if you have medications, some people have good experiences, but the vast majority of customers have experienced a poor customer service, poor customer experience at the pharmacy. And it's not just because they don't get things delivered. I mean, yeah, lines are long, and that's true, but oftentimes your insurance company doesn't pay for medication, or they reject the insurance submission, and so you end up paying a lot more or have to pay out of pocket. Sometimes there's a failure to coordinate with the physician. So you go to the pharmacy and the pharmacy says, hey, your doctor didn't authorize this refill yet. Sorry, I can't help you. Or there was some clarification needed on the prescription itself from the doctor's office. They said, and this happens all the time, if you're inside a pharmacy, you would see this. A lot of customers don't see this, but the doctor said, hey, take this 3 times a day for 2 months, and here's a 90 pill supply. That's not internally consistent, right? If it's 2 months, you need 60 days worth times 3. And so all of these problems cause disruption in service. Inventory is a huge mismanagement in pharmacy. I don't know why CVS and Walgreens have such a hard time, but 26% of the time that a customer comes in to a pharmacy, that pharmacy's out of stock. 26% of the time. That's not counting problems with insurance and problems with the physician coordination. So there are a whole lot of problems that go on inside the pharmacy, and that's what we focused on. So Sumit and I, my co-founder Sumit, we went inside pharmacies. We started looking at the systems and the processes that run pharmacy, and started to realize that if we're going to build a modern pharmacy experience, we've got to rebuild all of that technology inside the pharmacy. Forget about the delivery for a second. That comes along, and we'll talk about how that all works. But inside the pharmacy, you've got to nail first. You cannot do a same-day delivery pharmacy. If your insurance company rejects the claim and you can't get that medication today, it doesn't matter if you offer free delivery. You're not getting that medication today. Same thing with inventory, same thing with physicians. So to fix pharmacy, you got to fix what's inside the pharmacy using modern technology. The industry is 30 years old in terms of technology. They're using Windows-based technologies to run their pharmacies. Many of you have heard commercial software, ERP systems, right? Enterprise resource programs that manage inventory and things like that. That's essentially what is a pharmacy management system that runs every pharmacy in the country. And these systems are really outdated. So we set out to build a new pharmacy management system, an ERP, a modern ERP for pharmacy that solves all of these problems that we're trying to solve as best we can. We can't solve every problem, but vastly reduces these causes of service interruptions and service failures. And that's how you're really going to compete inside pharmacy. That's why I want to spend a lot of time here to really lay the groundwork on what we are trying to build. Now, if you can solve a lot of these service failures, you're creating a different customer experience above and beyond adding delivery, right? You're creating fewer times a patient has to come into a pharmacy, get a rejection from insurance, have a delay from the physician not authorizing the medication, have an inventory issue. All of those problems are being vastly reduced by a modern technology system inside the pharmacy. You also get, let me just go back to that for a second. You also get far more efficient processing inside the pharmacy. If you looked inside CVS and Walgreens, there's literally someone in the back of that counter counting out pills in a tray. They count out by 5s or 10s or sometimes 1s. It's insane. You shouldn't have manual processes like this in a modern age. If you can build robotics and other automations, you can streamline what's going on inside the pharmacy. And so not only are you getting a better customer experience, you're also getting along for the ride a more efficient dispensing cost. Your technicians and your pharmacists are spending less time paging through screen after screen on some Windows-based system. And we've seen these. I mean, Sumit and I looked at all the systems available. They're horrendous. They add minutes and minutes and minutes to every process, every prescription that's going through the pharmacy. And so you've already got better customer experience. You've now got better efficiency inside the pharmacy per dispense. And now you can start to think about, hey, if I don't have to spend all that retail space, right? Because I'm using commercial space and delivery, and I have a more efficient dispensing, I'm picking up expenses. I'm saving margin on not having fixed overhead on that retail expense side, having commercial space. I need fewer locations. They're a third the size, a third the cost per square foot. I have a far reduced fixed overhead component. And the fixed overhead in the traditional pharmacy adds about $4 or $5, even $7 in some areas per prescription just for the rent, right? So we take that away using our commercial space. It's about 50 cents per order for NowRx compared to $7 or $8 in a CVS or Walgreens just for the rent in many jurisdictions. And we also have reduced dispensing costs to less than half of CVS and Walgreens because of our automation. So those are the two things you get. You get another thing along for the ride. Because you've reduced a lot of these, sorry, I didn't click the right bullet, but now you've got it up there. Because I've reduced a lot of the mishaps and service failures on the insurance side, on the inventory side, coordination with the physician, you're also reducing friction for physicians. Physicians have a horrible pain point with pharmacy, and our technology systems, our software systems make their lives easier. Now you've got something really powerful. You've got a referral channel from physicians who would rather their patients use NowRx because it's not only better for the patient, but it's better for their office. Every time a patient has a bad experience at a pharmacy, guess who they call? If the insurance company didn't cover that med, they 9 times out of 10 will call the physician. If there's a problem with the physician's prescription in the first place, of course they're calling the doctor. If it's out of stock, they need to call the doctor to order something different, depending on how urgent it is, or send it to a different pharmacy. Guess what? That's a phone call to the doctor. All of these service failures are huge pain points for doctors. So we've got better customer experience, better efficiency on dispensing side, and a powerful referral channel from physicians because we're so much better than the competition in terms of what we save for the physician offices. All right, we're going to drill down a little bit deeper, but just to top off, what NowRx is all about. We are a technology company first and foremost. We built something called Quick Fill. It's we think it's the industry's leading pharmacy management system. Again, it's like an ERP system for pharmacy. It does all of these things, coordinates with insurance companies regarding claim payments. We have an intelligent claim adjudication component to our software. We have predictive inventory using machine learning algorithms to maximize inventory, minimize out of stock instances, far better than the industry. We have a chatbot assisted customer service feature to our software. All of this, by the way, is under one cohesive software platform. We have our own logistics platform that we built from scratch specifically for pharmacy that's integrated with the pharmacy processing itself. So we can triage with an eye towards optimizing delivery routes. We have a fully end-to-end robotic dispensing system, integrating robotic dispensing instead of those people counting out pills. Our robots can sort, count, bottle, label, and cap a medication in under 30 seconds. You won't see that at a CVS. And it's fully integrated into our pharmacy management system and our user app. So we can have a situation where the patient is sitting at home, clicks a button on the NowRx app, says, yeah, I do need that refill. It goes to the nearest NowRx micro-fulfillment center. It goes to the robot, and it's prepared in under 30 seconds without a human touching it. We still have to review it with pharmacists and all of that. We follow all the regulatory restraints, but that technology is very powerful. And we also have two-way electronic communication with doctors. We're cutting down on the number of phone calls that a pharmacist and a technician have to make. They're not waiting on hold, waiting to talk to a doctor's office. That communication is done electronically right to the physician's EMR system. Same goes for the insurance company. We're communicating electronically with insurance companies through the back end. That's all of what our technology does. It's a full pharmacy tech stack, and we have 2 patents pending, more development underway. I'm just going to drill down a little bit more on the micro-fulfillment component of this. I think it's incredibly powerful. You're starting to see this more in other industries. To me, micro-fulfillment is, again, taking that core pharmacy dispensing capability out of a retail location and putting it into a commercial warehouse. Because I'm doing delivery, I don't need one of these dispensing locations on every street corner. However, I do want them in a community with a pharmacy. And this is the key to micro-fulfillment. These are not some far away kind of mail order locations where you have one 4 states away, trying to send things across state lines. It takes 3 or 4 days. These are micro-fulfillment locations inside communities, 5-10 miles away from patients. So we can do same-day delivery very effectively. We can even do a 1-hour delivery for truly urgent medications, which is something that, you know, the retail pharmacies have that capability, right? They've trained customers to expect in pharmacy same-day delivery. That's why, you know, there's a pharmacy on every street corner. And that's been that way for 50 years or more. Patients are used to same-day service. If you're going to compete with that corner store pharmacy, you cannot replace it with a mail delivery pharmacy that's 6 states away. You're not going to be able to provide that same-day service, and that's what patients want. We'll talk more about that in a moment. But micro-fulfillment's a very powerful thing. We have 1/20th as a number of micro-fulfillment locations required for the same territory that's served in a retail format, a traditional brick and mortar format. This slide here is real data. This is not a simulated data. This is where all the CVS and Walgreens are located within 5 miles of our Mountain View micro-fulfillment location. 20 CVS and Walgreens. I serve that whole territory from NowRx with one location that's a third the size and a third the cost per square foot. That's the power of micro-fulfillment, less than 1% of the fixed overhead, which again is between $4, $5, and even $7. In Mountain View, it's $7 ad for that retail rent per prescription. All right. So for micro-fulfillment, NowRx is building micro-fulfillment locations. We rent them. It's not a lot of capital up front. It's very efficient commerce. It sort of blends, in my mind, it blends the best of the offline world and the online world. We have offline benefits of being close to a customer so they get same-day service and even 1-hour service, but we have the efficiencies and automation of a traditional online world. And this micro-fulfillment concept has been coming bigger and bigger in modern consumer service industries, and I think it's incredibly powerful. All right, so that's what NowRx is all about. Let's talk about now more deeply about the pharmacy industry and who are the players and who are the competitors and how's this startup company called NowRx gonna compete and thrive. I made some new slides today, so I apologize. They're a little bit rough around the edges, but you know, they'll get the point across. So we're going to think about the pharmacy industry in 3 components. There's the retail side, which is your traditional CVS and Walgreens. There's specialty, and there's mail. I'm going to drill down a little bit into each one. Specialty pharmacy is something that not a lot of folks generally think about unless maybe you have cancer or hepatitis or some other, more complicated and intense disease state that requires some unique medications you don't typically find at CVS and Walgreens, right? And there are companies that focus on this type of pharmacy product. It's a distinct segment of the industry. Companies like Centene, used to be Accredo and Diplomat. Now CVS has a specialty arm devoted to this. If you have, that, or someone that has that kind of disease, they're not going to CVS or Walgreens. They're asked to call this specialty pharmacy. That specialty pharmacy has an intense engagement with the patient. It's not just to dispense the medication and forget about the patient. They follow up with the patient every 24 hours, 48 hours. It's a much different environment. The average order value is about $2,000, but it could be as high as $100,000 for medications. I mean, it's just a completely different animal. And I'll circle back to this because there are competitors in the pharmacy space. The tendency is to lump them all together, but you really need to understand what's that competitor going after, right? Are they going after retail customers that are wandering into a pharmacy at Walgreens or CVS, or are they going after someone that's a cancer patient with specialty treatment? Mail delivery is another segment that needs to be called out. It's interesting, pharmacy was one of the first industries to really transition to, an online experience where you log in and order a medication or a refill and they send it to you in the mail. That would sort of eventually become like e-commerce, right? But pharmacy started this 15, 20 years ago by companies that a lot of people haven't heard the names of. Express Scripts, OptumRx. CVS also has a mail order pharmacy, goes under the name of Caremark. Great for certain medications that don't change all the time. You don't have to keep going to see your doctor every month, or the dosage doesn't change. Getting it 3 or 4 days later or a week later is okay for those medications. These are sort of maintenance medications. Doesn't help you though if you have an antibiotic. Your kid has an ear infection today. You took them out of school. You go to the doctor's office and you want to get that antibiotic right today. You're not going to wait. Your wives aren't going to wait. 5 days to get a refrigerated medication, or your husband's, I should say, as well. So it's a unique service mode that applies to a segment of the industry. It's about a 90 billion segment. The pharmacy industry at large is more than 300 billion, so close to 400 billion now. So it is a valuable segment, but doesn't really support the same type of customer experience that retail pharmacies do. That why there's a CVS and Walgreens on every street corner. And by the way, I like to point out, all the complexities that we talked about in the beginning of this. The coordination with your physician, resolving insurance claims and rejections, managing inventory. Customer service that's nearby and local. None of that's really readily available in mail. It's just not really well suited for that. And that's a reason why, in my view, that mail delivery hasn't really made a big dent in retail pharmacy. I mean, they haven't really put away CVS and Walgreens, and these mail delivery pharmacies have been around for 15 years. In fact, if you look at the data in the last 5 years, it's been in decline. And to me, that is evidence of what I am saying, that mail delivery in pharmacy, because of the complexity, because of the way customers have been trained and have come to demand same-day service, mail delivery is just not the answer for pharmacy. If you're going to go after the 300 billion in pharmacy that's being served out of brick and mortar corner pharmacies, you've got to come up with an answer that can provide the same kind of same-day service that customers are used to. And that's why the micro fulfillment strategy is necessary. That's why reducing those service issues that can cause delays are so vitally important. And so, this is the way the industry breaks down from kind of a high level. We'll go a little bit further. Obviously, we're going after the retail component. There's another company out there called Capsule. We'll talk about a little bit more detail. Another startup going after the retail space. There are some other competitors. Alto is out there, Medley. They're clearly on the specialty side. They focus on specialty medications. We'll talk about, can there be crossover between retail and specialty? I'm going to get into some detail around that's not as intuitive as you might think. And then you have the mail delivery companies. And Amazon today is mail delivery. And that's what PillPack is. PillPack, which is a company that Amazon bought, is a mail delivery pharmacy. They have 2 or 3 locations nationwide. They send things from several states away. Amazon is now adding to that. So they're adding more locations. They've got their delivery down to 2 days, quote unquote. I have something to say about that because I tried it and it wasn't 2 days. It was more like 10 days. But that's just kind of the way the basics of the industry lay out. Here's another view. And there's one other segment I kind of left out of the previous slide, which bears some mention here. There are delivery logistics companies that are trying to make a play out of taking a medication from a CVS or Walgreens and bringing it to a customer. This is the third-party logistics play, quote unquote platform play. We don't pay this much mind, frankly. If you understand what goes on in a pharmacy and the problems with those service failures and service interruptions and managing inventory and communications with physicians and insurance, if you understand like how critical all of that is, this third-party delivery system is an utter failure. I mean, it is just really poor customer experience. You're adding yet another possible reason for delay, another middleman. They need their own pound of flesh. And if anything happens with your doctor or your insurance company or inventory, those companies that are those third-party logistics companies have zero capability of fixing the issue. And so it just drives a really poor customer experience. But people have tried it, and we've seen some startups try it and fail. we're not too concerned. So if you accept the fact that you've got to own fulfillment, you've got to own the process inside the pharmacy to really win in this space, that puts you up against CVS and Walgreens and Rite Aid and some of these other folks doing mail delivery. Express Scripts, Costco has a pharmacy. And so the competitors that are in that space, and we're going to talk about the technology that they're using as a differentiation point. You've got Amazon PillPack on the mail side, and then you've got Capsule, which is doing courier delivery like NowRx. Now, we put ourselves apart, and my next few slides are going to drill into some detail. Amazon and Capsule are both using legacy pharmacy technology. They're using an ERP system for pharmacy that is based on Windows technology, old technology, none of the modern experiences or automations that we've built at NowRx. So we're going to talk about that in further detail, but just think about that for a second. You got Amazon and Capsule that are, thought of as tech companies. They're wholly dependent on third-party technology systems to run every function inside their pharmacy. NowRx is different. We've built our own pharmacy system, and we're going to talk about that. We talked about that in the beginning. It's called our quick fill system, and you can verify that we're one of the only ones with a new modern system that's been certified to operate in pharmacy. So you have the specialty guys, and that's where Medley and Alto are. Alto actually built their own pharmacy management system, so that's why I put them in the core pharmacy technology quadrant here, because I do give them props for building their own pharmacy management system like NowRx, but they're focused on specialty, so they're not really a direct competitor. NowRx really thinks of our direct competitors as Amazon and Capsule, but we're the only ones in the industry focused on retail pharmacy that built our own modern pharmacy system. We're going to talk about this more, so I know there's a lot of questions. I'm just kind of setting it up. All right, so let's talk about the legacy guys, CVS and Walgreens. Don't they already do, delivery? Isn't this thing already over? No. So I'm actually not going to spend much time on this because, frankly, if you think CVS and Walgreens can provide a good customer service and experience by simply adding delivery, have at it. They don't really add free delivery. What they add is same-day delivery costs $9 per order. You can check that on their website. Their free delivery is through the mail, 2 or 3 day delivery. So again, you got to keep mail delivery separate in your head from courier and same day delivery. They do free mail delivery and $9 courier delivery. And it's been pretty dismal. And my view on this is that this is the real disruption opportunity here, because CVS and Walgreens are actually aligned. Their incentives are aligned to bring customers into a store for in-store pickup. I mean, they talk about this publicly. It's pretty clear. They've been doubling down on this strategy. They essentially put the pharmacy in the back of the store. They want customers walking in and filling up their basket. And they really don't care if you're waiting in line. They almost prefer that. So you're going to buy more things. You're going to buy another $25 worth of other products. That's a big driver of their profit. For those big retail stores. Remember, a lot of expense on that retail location. They got to make up for it somehow. And so they try to push all this upsell. You can see them doubling down on this strategy. You say, hey, Carrie, they're just going to change, and they're going to change on a dime, and they're going to go into free same-day delivery. Well, if they go to free same-day delivery, no one has to come into their stores anymore, right? What they're actually doing is they're adding clinic services in store. CVS has a health hub now where you have nurse practitioners and physician assistants inside pharmacy location. That's contrary to thinking that you don't want customers in the store anymore. That's actually a corporate strategy to create more reasons to bring a customer into a store. And Walgreens is doing exactly the same. They just acquired a company called Village MD that does what? Brings clinic services inside of Walgreens stores, which also not only does it kind of expose their horrible misaligned incentives that are contrary to today's consumer, but it also belies that they effectively competing directly with physicians, right, for clinic services. And one of our referral sources, which we're not talking about today, we're focused on competition, but our biggest referral channel is through physicians that refer patients to us because it's better for their office. Do you think physicians will continue to refer patients to CVS and Walgreens versus NowRx, given that CVS and Walgreens are competing directly for their patients. Even if they wanted to go to a new strategy and get rid of all their stores and go to a same-day delivery using micro-fulfillment, they don't have the technology and the automation. They haven't built a modern-day pharmacy management system or logistics. And so not too worried about legacy pharmacy. Let's move on to something more interesting. What about Amazon and Capsule? These are the folks really focused on retail pharmacy space. Look, Amazon's formidable. Let me talk about pharmacy, why I don't think Amazon's going to come into pharmacy and be very successful. Amazon's biggest competitive advantage is they're monstrous in size. They can buy more product than anyone at scale, and they can drive the price down lower than anyone, right? So they can be the low-cost provider. In pharmacy, that is not a thing. So 95% of prescriptions that are processed in pharmacy today, the $400 billion worth of prescriptions every year, 95% of that goes through insurance. So a patient comes in, provides their insurance card. When that happens, the patient's not paying for the cost of the medication. They're paying what's left over after the insurance company pays. So the insurance company pays the pharmacy. You submit a claim, Nowrx submits a claim, insurance company reimburses Nowrx, and the insurance company tells Nowrx, you need to collect $15 copay from the patient. And those copays are set by insurance, and they're the same for almost all cases. There are some exceptions, but by and large, they're the same across every pharmacy. It's based on insurance company, not pharmacy. So if a patient goes to CVS pharmacy, they pay $15. If they go to Amazon, they pay $15. If they go to Nowrx, they pay $15. That's what the price is, right? No one cares about how cheap the medication is. The customer price is a level playing field in pharmacy. The other advantage now Amazon tends to excel in is just, variety and kind of scope of SKU counts and having a huge variety of manufacturers and sizes. And in pharmacy, 98% of medications come from 300 medication types. It's not a terribly difficult inventory to manage. I don't know why CVS and Walgreens do such a poor job, but you can manage that quite effectively and cover 98% of all medications. Remember, CVS and Walgreens, pretty small shelving in the back of that pharmacy. This is not a tough inventory to manage. So there's very, very small advantage to gain by just being able to have a bigger inventory than anyone. CVS and Walgreens are just pathetic, but Nowrx does an incredibly good job of managing that inventory. It's not one of the advantages Amazon has. Capsule, again, focused on retail, direct competitor to Nowrx. There's no doubt about it. Raised a lot of money. They're using a legacy pharmacy management system. I'm going to show you what that means and what the results are. It's not scaling well. They're throwing a lot of money on acquiring customers. They're processing inside the pharmacy. Their communications with insurance companies is legacy standard, right? It's not modern. It's not efficient. They have far more service failures than a modern system like the Nowrx quick fill system can provide. They have far poorer communication with their physicians, far worse inventory management. And as a tech startup, it's kind of laughable to me. They're dependent on a third-party software system to run every part of their pharmacy. They built an app. That's great. Here's what they did. Amazon and Capsule both did this. They built an app and said, okay, now we're a tech leveraged pharmacy because we built an app. But underneath that app, inside the pharmacy, they're using existing legacy software, either Pioneer RX in the case of Capsule. You can go look at Pioneer RX. It's been around for a couple of decades. It's a Windows-based technology, outdated, horrible pharmacy system. That's what Capsule uses. So they've raised hundreds of millions of dollars and they haven't built their own software system for pharmacy. It's very hard to do. I don't blame them, but that's kind of sad to me. And Amazon's using QS1. What Nowrx has built is all of those features that we talked about: inventory, claim adjudication, customer service, the robotics dispensing, the physician communication, and logistics is all built by Nowrx, all part of one cohesive system. and that creates a much different experience. And you can verify this. There's a link here. We'll put it out on the Seed Invest forum. You go to the SureScripts website that controls anything that happens in pharmacy and communications in pharmacy and electronic prescriptions. They monitor all the approved pharmacy management systems in the country. And NowRx has one, and Capsule and Amazon don't have one, and you can verify on that list. How's that translate? Well, for one, customer experience is different, way different. If you look at customer complaints, look at one-star reviews. Capsule over 30% one-star customer reviews. That's a system that's not scaling very well. This is a modern tech company launched in the last 5 years that has 30% of all of their reviews are one-star. That's not very good. And it's because they're dependent on Pioneer RX. It's a bad system. It was built 15, 20 years ago. It's a bad system. And NowRx built our own system. And so we are far ahead of the competition, 5, 6 years plus. We're going to keep doubling down on our technology, and that's how we're going to maintain a better customer experience. There's not a lot of switching costs in pharmacy. So if I open up a store next to Capsule and they have 30% one-star reviews and I have less than 1% one-star reviews, it's very easy for their patients to switch to me, right? So it's about customer experience. Who can drive the best customer experience is going to win in the long term. This is our core competitive advantage, is our technology-driven customer experience, and it's clear to see the differentiation. Amazon's even worse. They don't have a Yelp review page. It's called Trustpilot. Go to Trustpilot, look at PillPack, and we're going to talk about this in more detail. 81% of their reviews are one-star. I pulled a couple from today. We're going to share those today. Real quick on the specialty side, again, Alto and Medley, complex medications. The specialty pharmacies in the industry already are pretty high touch. Many of them already do free same-day delivery because the medications are so expensive that the specialty pharmacies like Accredo and Diplomat, they already provide free same-day delivery. So the ability to differentiate is far reduced in specialty. It's a good niche. There's nothing wrong with that. I think Alto is doing particularly well in that space, but it longer term, it's a smaller segment of the industry and fewer chances to differentiate. We are actually getting our specialty accreditation, so we can move in that direction and add that on. And it's not that easy for them to move to our space. So sure, can Alto and Medley eventually compete with NowRx? They can, but let's talk a little bit about that further. If you think about the logistics for delivery in mail delivery in specialty, and delivery in retail, there are differences, right? Mail, again, it's for kind of non-maintenance medications that don't change a lot, right? So they're not acute typically. It's not chronic. They are chronic, but they're not urgent medications, right? So there's not a lot of urgency to get it out. 2, 3, 4, 5 day delivery is fine. If you built a logistics platform optimized for 3 or 4 day delivery, you're not going to use micro fulfillment. You're going to use big locations 3 or 4 states away. And that won't work for same day delivery. So you have a different logistics model. Conversely, if you built a micro fulfillment logistics platform where you have micro fulfillment locations throughout California and Arizona, like NowRx, inside communities near patients, I can add non-urgent chronic meds. It's no problem. I'm already delivering. I already have the capability. So moving one direction is a little bit easier than moving the other direction. The same is true for specialty. If you're doing $10,000 medications, you're not going to be as concerned about how efficient your delivery is. You can afford to send one driver out on an hour drive and deliver one medication. Again, you're going to have dispensing locations that are spread out much farther, maybe not as far as mail delivery, even if you're doing courier, but you're going to be, you're not going to have a micro fulfillment logistics model that's built on delivering not 1 an hour, but 4 or 5 deliveries an hour with 2 or 3 medications per delivery. You're getting 10, 15, 20 prescriptions per hour. That's a model that works. And again, I can add specialty to that, but having a specialty logistics model and trying to go to a model where I'm delivering $50 medications and having a driver drive an hour for 1 delivery doesn't work. So microfilment's powerful. Look at a company called GoPuff. They've really pioneered this micro fulfillment. in consumer goods. They're a $15 billion company. I encourage you to go check it out. So our contention is that moving from a specialty logistics model to a retail-focused micro-fulfillment strategy is difficult, but moving from a micro-fulfillment and kind of retail-focused logistics model to specialty is not hard. And the same is true about mail delivery, right? So moving one way is hard. Moving the other way is difficult. I'm going to go one more time back to Amazon. I know they're the big dinosaur in the room. Elephant, I mixed my metaphors there. But look, Amazon went into grocery more than 10 years ago, coming up on 15 years. And everyone said groceries are over. Amazon's going to own it, right? They launched Amazon Fresh. They doubled down even further, made a massive acquisition of Whole Foods 10 years later, 2017, 4 and 5 years ago now. Okay. Again, all the analysts came out and said it's over. Groceries are over. Today, Amazon's market share in grocery is 2.6%. Okay, it's not over. Grocery is a very complex industry. It's not like doing hard consumer goods like paper towels and floss and pens. It's different and it's hard. And Amazon's not doing well. Okay, 2.6% market share. It's a lot of money, but it's not really transforming the industry like a lot of people said. Pharmacy is even more complex. I hate to pause here and do this kind of detail, but it's going to be fun. I picked up these reviews from Amazon this morning, an hour ago, right before our call. So let's read this a little bit because I think it's instructive. These are reviews on Trustpilot about Amazon Pharmacy. The most recent review, you guys can all check this today. You ask for packs, they send you bottles. You're told they cannot cut a pill, then it arrives cut. If they have a question about your current insurance, remember we talked about insurance issues that cause service failures, they won't let you know. They'll just not send the shipment. There were 2 separate times the incident was enough that the rep said she was creating a ticket for it to be investigated further. A ticket because their system sucks. They're using QS1. It's evidence right here in front of us. No one ever reached out to me to say, I'm sorry we messed up so badly. Customer service portal not connected to their pharmacy system. These are system issues. What you request and what you get sometimes match and sometimes don't, right? Systems aren't talking to each other. It's like a surprise all the time. They're always nice and polite, but what good is it when they cannot effectively offer a primary service they provide? I like this last sentence. They're always nice and polite. Sometimes people bat away bad Yelp reviews and say, well, everyone has a bad customer service day. These are not customer service people having a bad day. They're saying the customer service people are polite. Their systems aren't supporting it. Their systems don't scale and it's causing service failures. And that's why the customer experience is 1 star. I can't tell you guys enough. I mean, if you just look at the technology behind the scenes, it would blow your mind comparing that to NowRx. So we're talking about competition. This is how I'm competing with Amazon. And this is after 3 years of Amazon owning PillPack. And this is what their results are. And here's the second most recent review this morning. The concept is good. Reality is not. Delivery just doesn't work. If your prescriptions never change, this is a good service, right? So mail delivery works when your prescription never changes. That's when mail is good. Does that apply to $300 billion in the pharmacy industry? Not for this person. She's part of that $300 billion that needs same-day service. Doesn't get served by mail. Amazon's a mail pharmacy. Getting updates on dosages or different medications into the pill pack is not easy. Of course, those pill packs are horrible if your dosage changes. It's a mess and you have to throw out the whole pack. That's why it's been around the industry for 20 years, but no one uses it because it's terrible if your dosage changes. There are so many levels to even talk to someone at PillPack when there's an issue as well. I like having everything easy to distribute, but dealing with PillPack can be frustrating even when the customer service reps are nice. So look, the customer service, these are not customer service people having a bad day. In fact, they're having a good day. They're very nice. The system behind the scenes is terrible. 81% on Trustpilot, 1-star reviews. All right, I'm going to end there and turn it over to some questions. Let's go, Phil. What do we got? Let me get my chat back up. Hang on. I'm going to end this show so I can see chat. Okay. All right. First question. Again, if we don't get to all the questions, and I think we can go past the hour if you guys want to hang on. I've got time, and this is kind of the fun part. So let's go. Number one question. What are your 2022 and 2023 revenue estimates? Okay, we're talking about competition today. I can throw out some numbers. Look, under Regulation A, under SEC guidelines, we are not, it's frowned upon to provide financial estimates that investors can depend on. So that's just the way the SEC looks at it. These are mostly non-accredited investors, non-professional investors, which is what Regulation A is all about under crowdfunding. So what I'm going to say is this. We were just under 14 million revenue in 2020. 2021 is looking like about 22 million. I expect that growth to accelerate because we are expanding into other locations, other territories, other states. There are some announcements coming soon. We just announced a new location in Las Vegas. So we're California, Arizona, and now Nevada. There are several more states being added in the next few weeks. There'll be announcements about that. Someone's doing an emoji here of celebration, which is kind of funny. So look, I think that's the best way I can answer that under the guidelines. Growth has been really good, about 80% annual growth rate. Last year was a little bit down from that because of kind of COVID lockdown and things, but we're ramping up. It's going to accelerate along those same lines. Are you concerned about not raising the full 50 million? Yeah, we're raising 50 million on seed invest. Look, we're really on a good track for this crowdfunding round. We're going to hit 11 million today. We're have a record start to our crowdfunding round. Most of the money in crowdfunding comes in the last month and a half of the raise. It's a very non-linear process. This is our third round on seed invest. We're very comfortable. We're very confident we're getting to 50 million. You know, we'll be raising for a few more months into the new year, but stay tuned. It's a momentum thing, and I think we're gonna get there for sure. We have authorized up to 73 million, and I think we got a shot at that actually, but we'll see. So are we a GoPuff for prescriptions? I think that is fairly good description. Yeah, we are a GoPuff for prescriptions, understanding that prescriptions is like, you know, the space shuttle versus drone. You know, GoPuff is the drone, we're the space shuttle. I mean, pharmacy is way more complicated than delivering potato chips and other things like that. There's coordination between so many different parties and so many regulations that it's really an apples and oranges there. But the micro fulfillment side, for sure. This is the modern consumer experience. You need to blend the best of offline and the best of online, and it's all about micro fulfillment. In industries where same-day service is expected, right? I mean, there's some things, you're ordering a pair of sunglasses, you don't need same-day delivery. But for prescription medications, you absolutely do. It's a requirement. Question number 4. Can you touch on your gross margins, how they've trended since starting NowRx? Would love to know how you're thinking about expanding those even further. In general, pharmacy is a fairly thin gross margin business. This is more about volume, right? It's going to be a huge volume and thinner margin play. And we love that because there's $400 billion every year up for grabs. And I don't think CVS and Walgreens have a chance. I mean, think about that, right? You should be excited by this competitive advantage discussion we had today. I don't see any contenders, frankly. Every new territory we go into has 800 million in TAM, and there's 50 territories like that across the US, and there's 400 pharmacies in each one of those territories. And I think we can kill every one of them. So it's a top line kind of play. It's a scale play. With scale, we'll bring the margins higher. We know CVS and Walgreens are running higher margins than us. They're about 25% gross margin, which even that's a little bit thin, but they make it work because of the massive volume. We're quite a bit south of that today. We're about 12 or 13%, and that's because of our scale. It's a scale issue. As we get bigger, we can negotiate more with our wholesalers where we buy the medication, so our cost of goods goes down, and we just got to get bigger. And we know we're going to meet and approach what the big guys are playing. And frankly, we don't even need to get that high. If we can get to 18 to 20% gross margin over the next several years, this business is going to fly. We're dispensing at less than half the cost per order already compared to CVS and Walgreens. They spend $20 plus per order just on dispensing, and we're at $8. And we're going to drive it even further. Again, it's our automation, it's our software. So this business really hums once we get our gross margin in the high teens, and that's coming. Just got to get to scale, which is why we're out raising money, of course. So appreciate your investors. Come join the ride. We feel really great about the crowd and the support we get, and join the mission. We're building this company to get to scale. We know scale is going to have a huge effect on gross margins, on efficiency and delivery, right? The more customers I have per square mile, which is as I scale, the more efficient delivery is. The more deliveries I have per square mile, and the less the cost is per delivery. So, and then dispensing side, as we get more and more efficient, we can build even more technology. So come join the ride, come join the mission. This is going to go big. I really believe that. I mean, this is a true disruption opportunity. Question number 5. What will you do if the big box pharmacy retailers copy your model? Look, I just don't think it's going to happen anytime soon. I think eventually they may get religion, right? I mean, CVS and Walgreens, they're panicking, right? They're shutting down 900 stores. That's not a very good sign. It reminds me of a company called Blockbuster. So look, just to repeat, they're incentivized to bring customers in. Their CFO has said this publicly. They believe in in-store pickup. I mean, it's just insane, right? Like, all consumers are looking for fewer reasons to come into a store. CVS and Walgreens are increasing reasons for customers to come into the store. So I don't think it's going to happen. Their incentives are just all wrong. But let's say they get religion and say, you know what, we're going to lay off, half of our staff or more, and we're going to shut down 90% of our stores. We shut down 900 out of 9,000. We're going to do the reverse. We're going to shut down 9,000 and keep 900. Look, if they do that, I mean, that's like turning an aircraft carrier. And now you've got to build a system. Can a customer depend on CVS to not have a screw up with the insurance company because their system doesn't know how to handle an error code? They're using this outdated pharmacy management system. It's actually like 3 different systems combined. So deep in the bowels somewhere in CVS, they've got to rip all of that out, move all their customers to a new pharmacy management system that does a better job of coordinating with insurance and the physician and inventory. They just don't have the chops to do it. At least there's no evidence to suggest they have the technology chops to pull that off, and logistics, right? NowRx is half pharmacy, half tech company in the pharmacy side, and also half logistics. I mean, that you got to have both, and I just don't see them doing it. If they use a third-party delivery company, guess what? They got to pay that company for delivery and profit off of delivery, and we don't have any of that overhead. So good luck on the big box guys. I don't see it. I think this is absolutely disruption. I think they're going the way of Blockbuster. I think what might happen is they're going to get hurt so bad over the next several years that they're going to have to make a decision about build buy, right? And I don't think they have the chops to build it. So I think what could happen out of this, I mean, we're gunning for IPO in a few years. I think 3-4 years. I think we're there, maybe sooner with a SPAC. CVS, in the meantime, may get religion and say, here's a company we could buy for several $1 billion, and at least try to shore up their stock price and start to try to make the transition using our technology and logistics. I mean, that could be an opportunity for a good exit for all of us. We're certainly open-minded to that. They know who we are. We've had conversations, but I think it's going to take them a few years. You never know how that thing goes, though. I mean, there's been disruption in these industries, and sometimes when it happens right away, and then everyone gets bought, and the whole industry gets upheaved. And so we'll see. Is that a word, upheaved? I don't know. All right, number 6. have there been any thoughts of getting inside the VA? Yeah, we talked to VA. We have a program developing around that. Absolutely. I mean, anytime there's a prescription and we can help customers have a better pharmacy experience, we are absolutely pursuing those. Nothing really major to announce yet, but there's certainly a lot of opportunity there. I agree with that. I like that question. Another question, 7. Have there been any thoughts? Oh, sorry, I asked that one. 8. Why only a 50% reduction in dispensing costs, manual versus robotic? I would expect a much higher benefit, not including capital amortization. That's interesting. Well, look, I tend to agree with that. I mean, one of the things I didn't mention this is the dispensing cost, guys, right? So I threw out CVS and Walgreens run $20 plus per order for dispensing, just the labor inside the pharmacy, the pharmacist, the technician, the paging back and forth on the software system. They're on the phone with the insurance company, counting out pills, manually. A lot of that goes away with NowRx. Part of this is also scale. So our Mountain View location, which is our largest volume location, is doing about 400 or 500 prescriptions a day. The robot system that we have has capacity to do 1,500 prescriptions a day, and it doesn't take breaks, by the way. So we're not actually at our full automation capacity. One of the things Sumit and I did is we researched some higher volume pharmacies. I mean, something people don't really recognize because we only see CVS and Walgreens typically. But if there are very automated, efficient pharmacies in the United States today, you just don't know where they are, and most people don't see them. The mail delivery pharmacies, the guys that are mailing prescriptions from 3 states away, have incredibly automated systems, conveyor belts, pharmacists with headphones with 2 conveyor belts, verifying prescriptions every second, heads-up displays. We've seen this. We've been inside those locations. We've looked at the technology. We've researched it. We know what technology looks like at more scale. We just need to get to more scale. So, in the Mountain View location, in a 5-mile radius, there's about 400 million in TAM there. We've got about 8 million. So as we get to scale and we gain more customers, we're going to push further into automation and more efficiencies. The mail guys run about $3 per order for dispensing. We're at about 8. We're down from 20. We're getting there, and we've done that just in the last few years. So as we get to scale and build more technologies like we know exist and put those to work, we're going to approach $3 from 8. It's going to take a few more cycles here over the next year or two, but yeah, we're going to get more efficient, believe me. That's why we're investing in R&D. So use of funds on this 50 million, almost a third, about a third is reinvesting in R&D, more technology, more automation, particularly as we scale. The other third is expanding new territories, new micro-fulfillment locations. And the other third is marketing, ramping up the marketing, direct to consumer, as well as physician outreach, and our telehealth component, which I didn't talk about today, but we have a telehealth component that goes with our same day delivery pharmacy. I don't know any other company in the industry today that can offer both of those. And we're going to keep pushing that. And we're now launching that in Arizona soon. So exciting stuff. How do you think about the value of the data that NowRx is capturing? I think it's incredibly valuable. We get raw data on medication usage, on interactions, on what they call adherence rates, which the industry is really big on, which is a measure of, how consistent are patients in taking that medication month after month, right? A lot of hospitalizations in the United States are unnecessary due to people not taking their medications. It's been estimated as a $300 billion problem for the healthcare industry. Forget about pharmacy. The healthcare industry has to pick up the tab if you go to the hospital because you didn't take your medication. And so something like 40% of all medications are not taken according to what the doctor expected, right? The patient doesn't pick it up from the pharmacy. They don't take it when it's home because it makes them feel bad or, interacts with something else. it was too inconvenient. They didn't feel like waiting in line. So this medication adherence is a huge issue. There's a data play around that. Patient analytics, it's the data we're gathering. You have to anonymize it, of course, for patient privacy. But yeah, there's a huge data play here. Any bit of data that can be collected is being collected by NowRx, and we are in talks with insurance companies and payers, as well as drug manufacturers, on how to monetize that. So it's an entire additional monetization plan there. And we're now starting to get to the size where that really is starting to work well with in terms of size of data and the kind of trials and things we can run. Number 10, I'm just going to keep talking. If people want to drop off, they can drop off. Looks like how do I see how many people are still on? I don't know. I'm going to keep talking and then I'll check and come back. Or maybe Phil, you can pop on and let me know when enough people have dropped off. Well, let's go at least another 15 minutes here. Question number 10. CVS and Walgreens are currently providing COVID testing and vaccine boosters. Will you be able to provide these needed services? We do provide those. I got to be honest, it's not a big push for us. Our micro fulfillment locations are not really optimized for patients coming in. They're welcome to come in. Some patients do. But these are very highly efficient pharmacy operations with a lot of automation, and a patient coming in is sort of outside of the normal workflow. So not something we're really pushing. It's not a big profit center. Vaccines, you have to have a pharmacist. They're very high paid individual per hour, highest paid in the whole pharmacy. And I mean, they make really good money. You're something like $70, $80 an hour, fully loaded. You don't really want them spending 10 minutes giving someone a $10 vaccine. Doesn't make a lot of sense, but it is something we offer, for the community during COVID pandemic, and we'll continue to do things like that, but it's not a big mover. Question 11, what is your pricing compared to the mail order pharmacies? What's the status of Amazon entering this business? I think I covered this. I'll just touch on it again. Pricing in pharmacy is by and large a level playing field, because it's set. The price really, if you think about it, is not what's borne by the patient. The patient 95% of the time uses an insurance card, and so that patient's not paying the price of the medication. The insurance company's paying for it, and the patient's paying whatever's left over, which is the copay, which is set by the insurance. So when we talk about price, low price in pharmacy, I like to just remind people to kind of slow down and think about that. In pharmacy, it's like going to the doctor's office. Like, who's got the lowest price for physical? When you go to your doctor, do you think about it that way? It's the lowest price provider. I mean, all of that's paid by insurance. Look, there are some cash pay situations. If you have a medication that's maybe $8 cash, right? It's not an expensive medication. It's something that's been around forever. It's generic. You may not run that through your insurance because your insurance copay might be $15 and the medication's only $8. It makes no sense to run that through the insurance. You just run it through cash, you'll pay $8. So there are some medications where there's a traditional price concept, but it's 5% of the industry. Just keep that in mind. It's the lesser part of the industry. So yeah, for mail delivery, for Amazon Pharmacy, for CVS, for Walgreens, the copay, the price is set by the insurance plans. It's a level playing field. There are some exceptions to that. Some insurance plans will say, look, you've got to go to CVS, Walgreens, mail delivery, pharmacy, and your copay will be less if you go there. That's pretty rare. It's less than 10% of the industry have these closed networks. We've had that situation every once in a while, but we've grown, 80% combined annual growth. And so it hasn't been a problem for us. We generally win those patients anyway, because they want the convenience of NowRx and they can use us for everything, not just the medication that goes through mail. Amazon, I've already talked about this at length, so encourage you to go back and rewatch this video, which we'll record. It has been recorded. We'll post this out on the forum. I'm going to skip over that last part of that question. Number 12. Please comment on all the stores CVS is planning to close. Yeah, they're closing 900 stores. Hooray. It's hyperbolic to say they're going the way of Blockbuster, but I mean, it just seems so obvious to me. There will be people that will differ with my opinion, but and that's fine. But look, they have a model based on bringing customers in to a store. Customers don't want to come in. They're going to kind of scramble for a smaller and smaller piece of the pie for those customers that actually like going into stores. I mean, there are customers. Look, if you're a retiree, you're 68, you're going to go down and see Sally behind the counter at the pharmacy. You've known her for 10 years. You know, it's your days, it's your morning walk, and you're going to stop off on Starbucks on the way back. You know, that customer is probably not going to come to NowRx. They like going to see Sally at the pharmacy. And that's what CVS is focusing on more and more. You know, they're gonna get that segment of the population, and that's fine. You know, good luck with that. Now, the problem is, as you start shutting down stores, we've seen this happen actually in the Bay Area. Walgreens shut down for some reason. Their volume was going down. Can't imagine what happened there. And the volume dips below the level where that store is profitable because they're not getting enough foot traffic to pay for. For all the upsells and to be able to pay for the retail space. So they shut it down. Well, all those customer files that remain in that Walgreens got transferred to the next closest Walgreens. That Walgreens got inundated. I mean, the week that happened, there was a line literally outside the Walgreens store, going outside the door onto the sidewalk for patients waiting to get service. So there's a vicious cycle here as those retail stores get shut down and patients have fewer and fewer options. The staff at the remaining stores get more and more overworked. The systems get further strained, right? This is a disruption cycle. I don't know if you guys read Clayton Christensen, but I mean, this is the innovator's dilemma. They're in real trouble and it's going to accelerate. And those are my thoughts on the 900 stores shutting down. CVS, stay tuned because there's going to be some more of that coming. Question number 11, what was the revenue for November? We had a good November, almost 2.1 million. We'll be announcing that soon. So thanks for the question. Number 14, can you share planned new market openings per quarter for 2022? I don't like to telegraph with too much specificity where NowRx is going next. There are some competitors out there, Capsules opening up a lot of locations, Alto, not a direct competitor, but we're not going to telegraph too much. But I will tell you, general terms, we are expanding throughout Western United States over the next 6 months. There's going to be announcements coming in the next few weeks. We're signing leases. We're looking at spaces. We're embarking on a nationwide expansion. We're just going to do it sensibly, sort of Western states first. And later in 2022, we'll start to plunk down some Eastern state locations as well. So I hope that answers that question sufficiently. I just don't like to get into, location by location opening. We have a plan. We have a monthly and quarterly plan. I have it all. I just, I don't like to telegraph it too much. What other metrics that we as the investor should be watching that will help us evaluate your strategic plan execution? That's a great question. It's hard to do since I'm not under the SEC Regulation A. It's hard. You don't really have my projections to be able to compare us up against. So I understand the question. I would just tend to look at our growth. We will, continue to announce things quarterly. Look at the quarterly updates that we send out via Seed Invest, and track our growth. And the metrics we report on are revenue, but also customer growth, physician prescriber, number of prescribers that are referring patients to us, growth, And we occasionally, will include some other metrics, certainly new locations and new territories and how those are ramping up. I'm going to give that some more thought since you asked a good question around some other metrics that investors might like to see, and we can put in those quarterly updates. The things I track, are on the efficiency side of things. What's the cost, the delivery cost per order, the dispensing cost per order. We track those very closely. Our whole team does. Customer service reviews. So we really look at our Yelp reviews. We do a weekly meeting on any issues that arose with a patient, even if it doesn't result in a bad Yelp review, which it almost never does at NowRx. You can check that. That's hard to do, right? Not having 1-star reviews in any industry. Pharmacy customers are not particularly forgiving. Check out our Yelp reviews, and we're going to be 22 million in revenue across 8 different locations in 2 states, soon to be 3. And to have no 1-star Yelp reviews, have basically 5-star Yelp reviews across all locations is quite a feat. But we look at mishaps, anything that was less than perfect for a patient, and we have a weekly review. I get involved in those personally. And we look at how can we fix this? How can we either invent a new process or build more software systems and things to help improve that going forward. So those are kind of the metrics I focus on really closely. Of course, revenue and new territories and new customers, those we report on freely. We do an SEC report twice a year. You can look through that. There's a lot of metrics in there. Go to sec.gov, I guess. Or is it .com? I don't even know. I think it's sec.gov. Look at NowRx. You can see all of our filings for the last several years, twice a year. There's some detail in there. We are an financially audited company and have been for 5 years. So you get a ton of metrics there if you want. All right, number 15. I assume competitors don't share internal operational information with NowRx. That's correct. In order that NowRx can otherwise be able to compete with them and go above and beyond competitors' quality of service. True. So that's a statement. So question is, how does NowRx obtain such information and use it for effective, advantageous competition? We don't get overly obsessed with what our competitors are doing. I mean, fundamentally, again, we know Amazon and Capsule are using outdated legacy systems, and we can see their problem scaling. So we believe the key is simple. You've got to have the best customer experience if you're going to compete in this industry, bar none. The way you build the best customer experience is building your own pharmacy management software and working on it every day to make it better and make the customer experience better using technology. That's been our philosophy from day one. We've executed on that. We've seen the results. That's what we're going to keep doing. It's that simple. You go down layers, right? A delivery was late. Why was it late? 2 years ago, we had a delivery maybe missed completely. Now it's just late 5 minutes from what we said. So it's a different order of problem. You keep drilling down. Maybe it's 5 minutes late this time. Maybe next year it's only 30 seconds late. So the problems become more and more refined. And that's what we're doing. It's a process improvement. As we get to scale, there are scale issues as well that we look at. But we built a system that is enterprise grade and capable of scaling to billions of dollars in revenue and transactions. And I'm not sure that's answering the question. I don't worry too much about competitor metrics other than their Yelp reviews. And I think they're pathetic, frankly, compared to ours. Question number 16. We'll go a couple more minutes here and then I'm going to wrap it up. We'll get the rest of these questions online. All right, everyone. I have concerns regarding the inefficiencies of home delivery in LA or Bay Area because of traffic, clogged freeways, particularly using when only a few fulfillment centers in a large urban area. I'll tell you what, the biggest the area that I have the least concern about is delivery efficiency. I mean, we have done it. I mean, in Mountain View area, we're averaging 5 deliveries per hour already in our Mountain View facility. That's amazing. And that means at some parts of the day, it's 6 and 7 deliveries per hour. I mean, that is at the upper limits. You have a driver stopping off every 10 minutes at a house, and you can see these routes. I mean, we've shared some of this online and in our investor video. You can see how the density of those routes, and it's a friend of scale. The more customers we get in a particular territory, say Mountain View, we're continuing to grow, right? Every new customer we get, customers per square mile go up, deliveries per driver hour go up. And so it's continuing to get more efficient. Now, not all routes are efficient, right? We have some routes during traffic or particularly far away patient with another one that happened to be going out at the same time. But we're averaging 5 stops an hour overall, and some are far better. A year ago or 2 years ago, we could not have claimed that. It was, 2 or 3 stops an hour. So we've seen the effect of customer density, and we have models and know that's going to continue to get more efficient. So look, let me give you some more figures to think about. Fully loaded driver, salary and benefits, and then let's add in also amortization of a car and cost per mile. Okay, we use electric vehicles. It's a third of the cost per mile. Let's add all that in. It's $30 an hour approximately. Okay, it's a rough number. It's a little bit less than that. Let's use 30. Easy math. If you do 5 deliveries per hour, and each of those deliveries has 1.5 prescriptions, which is what the average is. Okay, we're at 7.5 prescriptions per hour. Let's round that up to, let's round it down. Let's just say it's, because that math's going to be messy. I tried to do easy math and I made it messy. 7.5 divided by 30, or 30 divided by 7.5. Okay, that's $4. That's easy math. That was easy math. That's $4 of delivery cost all in per prescription. The cost of retail space in Mountain View, if you look at CVS and Walgreens, there's 20 locations, right, within 5 miles of our Mountain View facility. 15,000 square foot locations. A lot of math here, guys. 15,000 square foot locations, $6 a square foot per month, $90,000 per month for each one of those locations. Let's just take one of those locations. A typical CVS pharmacy does about 5,000 prescriptions, 5,000 or 6,000 prescriptions in a month. Okay. Now, how you want to allocate that $90,000 in rent per prescription? It's at least $3 or $4 per prescription. I mean, you can allocate some of that rent to the front end of the store sales and some of it to the prescriptions, but it's at least, any way you slice it, it's at least $5, $6, $7 per prescription if you're going to defray that retail rent cost per prescription. $5, $6, $7. My delivery cost is $4, trending down towards $3. I'm already ahead of the game compared to CVS and Walgreens. That's how powerful the micro fulfillment strategy is. So people ask me all the time, how do you afford to do free delivery? The question we should all be asking, how does CVS and Walgreens afford to have a 15,000 square foot location in the center of town on every street corner? That's the real question that no one asks. These are gigantic stores, prime real estate. How the hell do they afford that? You ever see how many people are wandering around CVS? Not that many people. It's kind of a ghost town, frankly, except at the pharmacy counter. That's where all the people are. So incredibly inefficient model for today's busy consumer. Now you give me some savings on the back end where I'm dispensing at much cheaper, $20 versus $8 per order. You got to multiply that by 1.5 because there's 1.5 prescription, or divided by 1.5 prescriptions per order to get to a prescription basis. I've got savings there as well. So I am way ahead of the game compared to CVS. It's just a better model, people. Micro fulfillment, check it out. It makes so much more sense for today's busy consumer. GoPuff, $15 billion company, proving that out right now. There have been other examples in grocery delivery, and there's going to be more and more. Hey guys, I think we should probably put a pin in this one. I'm going to look ahead, see if there's one more good question, and then we'll wrap it up. How about that? All right. I'm just going to scan. Give me a second. I'm reading. I want to get a good one here. Okay, physician referral channel. I love it. Let's talk about that. And then there's one on Alto. I'm going to do two more. Okay. Here's a question around how we get customers, right? Because of our software systems, we are way preferred for physicians. They don't typically, at least not on their own volition, do a lot of work determining what patient goes to what pharmacy, because they're all the pharmacies are the same. But when we explain what we do and how it saves physicians time inside their office, because fewer problems with insurance, fewer problems with their own prescribing process, fewer problems with inventory, better medication adherence, which also drives physician reimbursement from Medicare. So if you have better medication adherence because you're delivering medications to patients, so there are fewer reasons not to take the medication due to forgot or didn't have access to transportation or too inconvenient. Remember, I talked about that medication adherence problem, $300 billion problem for the industry. If you drive better patient health through fewer unnecessary hospitalizations, physicians get higher star ratings and higher reimbursement from Medicare. Okay, so regardless, physicians like to refer patients to NowRx. 96% of every patient, and we're over 37,000 customers now, 97% have been referred from a physician. All right, so that's our model. We go in, we open up a new territory, we go talk to physicians, they build a trust with us, and they refer patients to us free of charge. We're not allowed to pay physicians a nickel. Can't. So we don't pay them anything. So this question about physician referral channel, is it very expensive? The expense we have there of getting these customers through referral is the cost of a physician rep to go talk to a physician, right? So if you look at all of our physician reps in each territory, add up their salaries, look at the number of new customers we're getting from those physician referrals in that territory for those physician reps. These are our employees. That's the only expense we have. It's less than $50 for a new customer. I challenge you to find any consumer market where you can acquire a new customer for less than $50. In the internet world, direct to consumer, it's like $300. All right. People don't click ads anymore. It's a very difficult mode of acquiring customers. We do in some cases for some products where we can afford it and the lifetime value is high enough. But for most of pharmacy, that's a difficult path using digital. But the physician referral channel is huge. And it's the gift that keeps giving. The more their patients use NowRx, customer experience, remember, being critical, the more they hear great customer experiences and patient experiences, the more they refer more to NowRx. So build the best technology, gives you the best experience for patient and physician, and get more business in a very powerful growth channel with huge ROI. Last question. What stops Alto from moving into retail? We talked about that today. So Alto has built a logistics platform focused on hepatitis and fertility primarily. They're a specialty pharmacy. It's how they started out. I know they advertise and they do other kind of medications. Their entire model is primarily focused on hepatitis and fertility and HIV and things like that. Very high-end medications. Their average order value is about $2,000 per order. Ours is about $100 or $150. So it's a completely different segment of the market. If you're driving a $2,000 medication, you don't mind if your driver drives an hour with only one patient and one delivery. That works. If you're driving a $150 medication and you're getting 20% gross margin, which is about $30, you can't have that driver driving for an hour. You can't do it. You need your delivery costs down to like $4 per delivery. I've built that. They haven't built that. If they're going to try to do move from their logistics model where they have one location for all of the Bay Area, and they're going to try and deliver a $150 medication, that's going to be a money-losing proposition, right? So they haven't built what we built. Now, can they build what we built? Sure. With enough money and enough time, anybody can build anything, but they haven't yet, and it's going to be very hard for them to move this direction unless they build what we built, which we've already built. So we're ahead of them, right? Amazon can build what we built if they build what we built. Right? If they build what we built, then yes, they can do what we did, but they haven't built that yet. So can everyone compete with us? Of course. We're 5 years ahead, okay? And we've perfected micro-fulfillment. We're one of the only companies with a modern day pharmacy management system that builds not only the most efficiency in the back end, but the best customer experience and a great referral channel from physicians. It's a $400 billion industry. CVS and Walgreens are leaving it up for grabs. I'm perfectly fine if Alto and Capsule want to each grab 10 billion and NowRx grabs another 10 billion. We'll be just fine. I think there's going to be multiple choices for patients over time, like there are today, right? There's CVS, there's Walgreens, there's Rite Aid. It's fine. It's not going to be a winner take all. If there were one company that was going to win $400 billion industry, I mean, that would be quite something. I don't think that's really realistic. Build the best customer experience. You're going to win in the long term. That takes a lot of technology. We're out raising money so we can build more technology. Love for you to join the mission. Love this conversation. We'll do more of these on different topics. And I think we're going to wrap it up there. Any questions we didn't get to, we'll put out in the Seed Invest forum, seedinvest.com/NowRx. Thank you, everyone. Have a great Friday. If we don't talk before then, have a great holiday next week. Thank you. Take care.